guys, you're welcome to another edition of my program called Health Talk with Queen Nikki. Health Talk with Queen Nikki. How you guys doing? You're welcome again. Okay, as my usual, have you subscribed to my YouTube channel? If you haven't subscribed, what are you waiting for? Run to YouTube and subscribe to my YouTube channel. Turn on the post notifications so you can get notified when I drop a new video. And the handle is called Health Talk Queen 1, Health Talk Queen 1. And also my TikTok. Follow me, share my work, download, share to your family and friends. And the handle is called Health Talk Queen. You want to subscribe to all this my social media because I post different content in both of the social media. So what's going to be our topic today? Our topic today is my most asked last year's December, but I was looking for time to discuss about it so I can do it a better justice to it. Okay, so our topic today is heart attack education. Heart attack education. Recently, we've been seeing people slumping, dying at party, wedding, occasion, and these are young people, which is alarming. Usually, it's like adults, like older people in the 60, 50, but now we've been seeing people in the 30, 20 slumming and dying of heart attack. So let's talk about it and dive into it. That's why I'm bringing it now. It's going to be part 1 and part 2. You want to watch both parts. So what is heart attack? Heart attack occur when blood flow to the heart muscle is blocked, causing damage to the heart tissue. Heart attack occur when the blood flow to the heart muscle is blocked, causing damage to the heart muscle. When the heart muscle tissue is blocked, it can cause heart attack. So now let's go into it. Like I said, we're not going to be explaining how it's blocked in the heart. No, I am not a doctor. Like I always say, I am a nurse, and my major priority is teaching, education, prevention, and that's why I am here. So let's dive into it. So what are the signs and symptoms to watch out for? These signs and symptoms vary from individual. We know we have different body composure, different health, different races. So that's why people can have one or two of this sign, and they can have one sign, but any of the signs, take it serious and seek for medical attention immediately when it occurs. Because in heart attack, we only have shorter window for intervention. If you don't intervene immediately or within 1 to 30 minutes when it occurs, that person can die finally. That's why we have to take it serious, and intervention, and it's timing is very, very important when it comes to heart attack. Timing for intervention, very important and crucial. So what are the signs and symptoms that we need to watch out for? Chest pain, very important. When you complain of chest pain and you go to the emergency room, they place you as priority because they want to make sure it's not heart attack. And the chest pain can feel like a pressure in your heart. It can feel like a pressure, tightness, pain, squeezing, pressure, and also aching. So if you have any of this, please seek help immediately. Go to the nearest emergency room and seek help. The next one is pain and discomfort. This pain and discomfort can be it can spread to the jaw area, the back area, the chest area, the shoulder, the arm, the neck, the teeth area. Any of those areas that I mentioned that you're having pain or discomfort, please seek help immediately. Fatigue, fatigue, like tiredness, fatigue is one of the signs of heart attack. Cold sweat is one of the signs of heart attack too. Heartburn and indigestion, you'll be having it constantly, not the regular heartburn. This is going to be severe heartburn. Even without eating, you'll be having the heartburn and indigestion. Please, indigestion. please take it serious immediately. Nausea and vomiting, take it seriously. It might be risk heart, it might be signs of heart attack. Shortness of breath, you won't be able to breathe. Shortness of breath is also one of these signs. Lightheadedness, and also sudden dizziness. If you're having lightheadedness, headache, netness, or what's it called, dizziness, take it serious. It might be signs of heart attack. So I'm gonna go over the signs again one more time. I said pain, chest pain, fatigue, cold sweat, heartburn or indigestion, nausea and vomiting, shortness of breath, lightheadedness, and also sudden dizziness. Now, what are the risk factors? We talk about signs and symptoms we need to watch out for. What are the risk factors? What contribute to heart attack? What are the things that you do that if you do it, it can contribute for you to have heart attack faster? The next first, or if you have it, that you need to watch out for. Okay, that's the risk factor. Age, yes. Before, like I said, we'd be having children, we'd be having young people at young as 20, 30s having heart attack. So, but mostly towards the 60, 50 years of age. But now things has changed. So anybody can have it, but the age bracket is 30 upward now that they are having it right now. Also, high blood pressure, that's another risk factor that we need to watch out for. I have a video on my TikTok and YouTube that I talked about high blood pressure. There are 3 videos. Please watch it. Very important. Control your high blood pressure and you'll be fine when it comes to heart attack. High cholesterol and triglycerol, very important. That's why I always emphasize it on my video that we need to do our physical, very important physical, yearly physical with our primary care doctor, very important, so they can check if it's high. There are some medication that they can give us, and we need to modify our diet for high cholesterol and triglycerol, very important. The next one is smoking. We need to avoid smoking. If you're smoking, yeah, and smoking, if you check the back, they say smokers are liable to die young. The choice we make in our life depends on us, and we want to avoid all those things. So, if you smoke, yes, you can have high risk for heart attack. The next one is obesity, overweight. Overweight too can be risk factor for heart attack. Diabetes is also another risk factor. If you have diabetes, you can have heart attack, risk for heart attack. Family history, that's why if you go for your yearly physical, they always ask you, do you have history of family heart attack? That's so that your doctor can well be prepared and make sure they look closely to your medical history and procedure. Okay, so unhealthy diet can lead to heart attack. When you're not eating right, yes, it can lead to stress. I have video also on stress management. You want to look at it, make sure you watch it. Very important, because stress too can lead to heart attack. Autoimmune diseases can lead to heart attack. And also if you have history of preeclampsia, during pregnancy, preeclampsia, I'm still going to talk about preeclampsia and eclampsia. Very important during pregnancy. Watch out, I'll be talking about it. So this risk factor, signs and symptoms, people can have 1 or 2 of it, or just one. You want to take it serious, and I said it varies from individual. Some people can have it one, some people can have 2, 3 of this sign, but any of the sign, take it serious and run to the emergency room for further intervention. I'm going to go into part 2, which I love. Part 2 is prevention. How do we prevent heart attack? What are the things we need to know? Let's go to part 2. Make sure you watch the part 2. Okay, I will see you in part 2.